You have done it. You have had the hair transplantation. Now you are on your way to a new hairline and a fuller look in the scalp. But the real works begin here. I am Dr. Halder, a board certified plastic surgeon, and in this video we will be talking about post hair transplant care. The first 2 weeks following hair transplantation are most crucial. The care and the management that you take in the first 2 weeks can directly impact your hair transplant result. But don't panic. A little being careful and patient will make your hair transplant story successful. The first 3 days is very sensitive. The hair follicles that we put, that is implanted in the front of your hair, creating the hairline and the density, are just like seeds. As the seed would take time to develop roots and then grow, similarly hair follicles also takes its own time to settle, to get the blood supply and then grow. First 3 days after you go back home, the main important factors that you have to take care is the elevation. Elevation means your head end is slightly more than the heart level. That means it should be around 35 to 45 degree. We can elevate your head end either by the use of pillow or by the use of neck support, or you can have a recliner if you have at home. That will make your life very easy while sleeping. Now, head end elevation creates a natural process of decreasing the edema in the scalp that has been operated. Secondly, we give a saline spray. Saline spray is sprayed on the transplanted zone to keep the graft moist, and also it soothes the scalp surface, and therefore the irritation and the little dryness is taken care of. In this first 3 to 5 days, you will also feel a lot of itch and scratchy sensation. So you are not supposed to scratch or itch. In case you are feeling so, you can just gently spray the saline, or you can just gently tap it with finger, no scratching. Fourthly, swelling is expected. Swelling generally appears by 3rd to 5th day and it goes off after 5 days. It is expected, so you should not panic about the swelling. Swelling starts from the forehead, then goes down to the upper eyelid, then the lower eyelid, and then passes off. So for decreasing the swelling, we have already suggested you to keep the head end elevation. We have already added a little medication in the discharge summary, and thirdly, you can use your facial movement and a little exercise to decrease down the swelling. The two more factors or important things that you might note is a little ooze in the back side of the scalp where you have taken out the hair. In case that happens, you can gently dab it with a clean towel. Sometimes, rarely, we do come across patients complaining of graft coming out from the surface. That is mainly accidental. If it happens immediately after the procedure, you can come back, we can put them back in. Otherwise, 1 or 2 hair loss graft cannot be replaced back because the hair root have died by the time you have come to the clinic. The most important question that I often get asked is, when can I get my hair shampooed, or when can I get my hair wash? The first hair wash that you get is on day 2 to day 3, and that is done in the clinic, and subsequent head washes is done by you at home. In case the scabs persist, then we can give a second wash between 6 to 10 days and to take care of the residual scabs that is on your scalp. Once you go back home after getting the first scalp wash, then you are supposed to do some care at home so that the scabs come out nicely and quickly. So for that, what we do, we advise you to apply a little olive oil at night so that the scalp soaks, and in the morning you shampoo the hair using shampoo, creating the lather or foam on your palm, and then gently putting it on the scalp surface so that the foam or the lather is completely covering the transplanted zone. You should keep it for 3 to 5 minutes. Then you should gently pour water using a cup or a mug or a jug. No shower should be used because shower has a pressure. We don't want any kind of external pressure to be applied on the first sensitive days. Once you have shampooed the hair, every day the scabs numbers will keep on decreasing, and once the shampoo is completed, then you will not rub with the towel, you will gently tap with the dry clean towel on the surface and the back. This frontal zone where the transplantation has been done, your movement should be very soft and natural. In the back where the donor side where we have extracted the hair, you can clean it more vigorously, there is no problem. The process of scalp wash and removal of the scabs is very important because the earlier the scabs are removed, lesser is the chance of infection and faster is the healing. So scabs removal is very important because it removes the external dead stuff that is sitting on your scalp. Let's talk about the future course of journey. After 3 to 5 days, when you have taken care of the crucial part of your post hair transplantation process, then comes the daily routine that you will keep subsequent to this. So, what we advise is to not to scratch or rub your scalp surface. Secondly, you should not wear a tight cap or a hat. You should, if in case you want to cover it up, you can wear a hoodie which is very loose. Then you should also focus on your hydration. Your water intake should be good, so that your blood circulation is better and therefore the survival is better. You should also have a good balanced diet which is rich in protein, because hair transplant is a procedure and you need lot of high protein, so that the building blocks is nicely nourished, nicely supplemented, and your growth is best. You should also avoid going under the sun, because direct sunlight exposure to the immediately traumatized area will have an impact, redness and delayed healing. And you should also think of not sweating vigorously, because sweat can irritate the scalp and thus you will feel more scratchy, and that can also have an impact on secondary infection. You should wash your scalp daily. You should not be delayed, because everyday wash will take care of the scabs away, and that will makes your scalp cleaner and cleaner day by day. Last but not the least, in case you have an habit forming abuses like smoking and drinking, you should avoid it, because smoking decreases the blood circulation, and if you stop smoking, the graft survival becomes the maximum. Okay, we need to talk about a specific issues which scares everyone, and that's hair loss, hair fall. So after 2 weeks following transplant, you might notice couple of hair falling every day, and that is a part of the process of hair transplantation, and this is known as a shock loss or a ugly duckling phase, where the transplanted hair, the shaft part falls off. But you have to remember, you have to keep it in mind that the root is not falling, it is only the top part. It is almost similar to a small sapling that you put in a soil, where the natural leaves falls off before new leaves comes out. Similarly, the graft is a combination of root plus the shaft. Shaft and the hair is the dead part. So, this root gets into the dermis and it tries to restore the circulation. The dead part of the hair falls off, and then subsequent to the blood supply restoration, the new hair pops out. And this is a process, and you should not worry about this process, because this is natural. This is only a phase, that is transient phase that starts from 2 to 4 weeks, and following 4 weeks up to 2 to 3 months, you may not see much growth, because the blood circulation, the graft is getting nourished till new hair is forming. So, you have to be patient, and you have to understand this is a natural part of the process, and it will take its own sweet time before new hair comes out. So, now if we see the timeline, up to 2 weeks it is the immediate care, 2 to 4 weeks is the hair fall or shedding of hairs, that is the shock loss, and from 1 month to 3 months is the dormant phase, where the hair follicle growth is not much, but the follicles are inside, they are trying to get the nourishment, the blood supply, and the new hair is coming out. But what we have noticed in our hair transplant program, never all the hairs that is transplanted is going to fall. It is only 30 to 40% which falls off, almost 50 to 60% remains on the scalp. So, even at duration during 1 to 3 months also, you will have significant number of hairs which are there on your scalp, and it will not be empty scalp, as that process, it does not involve all the hair. The shock loss, it does not involve all the hairs, it is only part of the hair that is going into shock loss. Rest of the hair will remain, and they will go into shock loss in due course of time, and that process of hair fall and hair growth you will not come to know. What you will know is just decreasing density, gradually getting into a more dense and fuller look. So, after 3 months, what do you see? From 3 to 4 months, you are seeing small hair sprouts coming out from the scalp surface, and this is the initial part of the hair growth. Then from 4 to 6 months, you have a increasing density that almost goes up to 60%. Then from 6 months to 1 year, you have hair getting thicker and thicker, you are getting almost near to normal. From 1 year to 18 months, your scalp is fully covered with whatever number of graft we have transplanted. So, it is almost the timeline is from 0, from the transplant time to 1 year is the timeline when you are looking for a nice looking growth on your scalp. At the end, when should you call your doctor? That is a very important question. So, after you have gone back home, there are certain situations where you need to contact your clinic or doctor, and every clinic has its own advice that is given to the patients for immediate call. So, most importantly, what we think is number one for callback is a bleeding or oozing from your donor site or your recipient site. So, if the oozing is more than normal, or it's continuously flowing, then you need to contact. We will advise you how to control that bleeding in case it's happening. It's not very common, but in case it happens, it has to be addressed. Secondly, sometimes graft can come out accidentally, and you should always call back your transplant team what should be done for the graft that's come out. As we have already discussed, swelling is expected from day 3 to day 5, but in case the swelling is persisting, it's not going, and there is a pus that is also forming on your scalp, then you should always contact your team so that something more can be done, and if anything extra to be done, that will be done in the clinic to take care of the problem that you are facing. So we have covered everything in this video about the post hair transplant care. If you are a post hair transplant patient or you want to know more about days following hair transplant, you can put in a comment. We'll reply them back, and thanks for watching. We will be coming up with more informative videos on hair care and hair transplant. Thank you.